You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. In the previous episode, we discussed what you don't know about the vulva. In today's show, we're going to dive into a specific part of the vulva that has long been misunderstood. The clitoris. Throughout human history, the clitoris is a piece of anatomy that has repeatedly been discovered, described, and forgotten. So we're going to talk a bit about the history of the clitoris. We're also going to discuss why it's only been in the last 20 years that we've finally developed a detailed scientific understanding of clitoral anatomy, as well as why understanding this is so important for women's sexual health and pleasure. Some of the other topics we'll get into include whether there's really a difference between clitoral and vaginal orgasms, how many nerve endings there actually are in the clitoris, as well as the surprising and important role of testosterone in clitoral health. I am joined once again by Dr. Maria Ulloco, a board-certified urologist specializing in comprehensive sexual health, reconstruction, and prosthesis. A former clinical professor at the University of California, San Diego, Dr. Ulloco is now the CEO of MUMD Sexual Medicine Consulting and the founder of Vulva AI, an innovative patient advocacy tool that employs AI to aid patients grappling with vulvovaginal issues. This is going to be another fascinating conversation. Stick around and we're going to jump in right after the break. The Kinsey Institute discussion series highlights current sex and sexuality research from a wide array of disciplines. Speakers include Kinsey Institute faculty, visiting scholars, affiliates of the Institute, and invited researchers. Lectures are both in-person and live-streamed. Follow at Kinsey Institute on the socials for more information or view recordings of past lectures at vimeo.com/Kinsey Institute. That's vimeo.com/Kinsey Institute. Okay, Maria, let's talk about the clitoris. So I want to start by talking a little bit about the history of it. And my understanding is that this actually seems to be kind of a hotly debated and contested area. But what can you tell us about when humans first discovered the clitoris? So in other words, when did people first start talking about it, or when did they first identify it? And at what point did they start to recognize its important role in female sexual pleasure?
Yeah, so that is a loaded question. And I think first and foremost, I think it actually speaks to a larger narrative of we want to believe that science is objective. We're like, yeah, data is objective, 100%, but who's interpreting the data also definitely matters. That is very subjective, and people bring their biases into it. And I think the clitoris is a foundational organ where you see that happen. If you look at the history of the clitoris, and we actually wrote a piece about this for the Journal of Sexual Medicine after we published our clitoral study, the clitoris has been noted. It's anatomy. It's just anatomy. Like if you're looking at a body, you should be able to see it. And it's been noted in anatomical textbooks throughout history, even from like ancient Egyptian times. The thing is, the people that were studying it and doing the anatomy textbooks, because the cultural weight of female sexuality then led to a lack of objectivity. That's period. That's what it is. So you'll read where, you'll see the clitoris in anatomy books and then it's removed. And you'll see it in anatomy books and it's removed. And over and over and over again, this continues to happen. And again, a wild thing. Like no one would just remove your hand out of the textbook because it's like a considered taboo. But that is what we were doing to this structure. And whenever people are like, science is objective, I'm like, yeah, to a point, asterisk. Come on, people. I always love to bring up this example of the clitoris. So it wasn't until Dr. Helen O'Connell, which is another urologist in Australia, that was like, wait a second, how do we not know what the clitoris looks like? We don't even know what the 3D structure of the clitoris is. And so she did MRI studies to fully define and map out the clitoris from an anatomical standpoint. And that was in the 2000s, right? This structure has been noted since early Egyptian times. And yet it took a female urologist to say, wait a second, we still don't know this. And she then did that study. Then we were the ones that defined how many nerves are in the clitoris. And I love this study. I love the history around this because it is my favorite rebuttal when people say science is objective. And I'm like, let me school you on some things.
In theory, science is objective. I mean,
Exactly.
objectivity is one of the core tenets of practicing science, but there are many scientists who aren't necessarily so objective. So, yeah, that is a very important point to keep in mind.
Yeah, I think data is objective. The interpretation of data is very much based on who is interpreting the data.
Absolutely. And, it is very possible for two people to interpret the same result in drastically different ways. And we see that happen a lot.
Exactly.
Now, what you described about the history of the clitoris is similar to historical accounts of female ejaculation, where, these are phenomena that are often reported as, something that was discovered, described, and then forgotten. And it keeps like repeating that process over and over. And it is very much connected to, these taboos around female sexuality more broadly and how that has hindered our knowledge and understanding of so much of women's sexuality. Now, you mentioned the work of Dr. Helen Connell, and it's fascinating, and I think has to be super surprising to a lot of listeners that it's only in the last 20 years that we've actually had this detailed understanding of clitoral anatomy. So when she did this mapping of what the clitoris actually looks like, can you tell us a little bit about how that changed our understanding of the clitoris? So I think before her work, people kind of thought it was just this little tiny thing that existed. How did her work change our understanding of the clitoris?
Yeah, so her work changed our understanding of the clitoris in several ways. Like, first and foremost, anatomy. Like, it's just like the pure tenets of being a physician. We take so many anatomy and physiology classes, and the idea that a structure just hadn't been fully mapped out it just kind of shows the lack of importance in the medical field, right? And it's a larger narrative. And we actually even talked about it. They're like, well, there are certain things about it that would have made it hard to do that. And I was like, absolutely. It's a more internal structure than the penis. A lot of them were doing cadaver studies, and because it's a hormonal tissue structure, your clitoris can shrink when you have less hormones. And so we acknowledge all of those things. And also 3D cross-sectional imaging, like MRIs, have been available since the 70s. Again, it took a woman to say, wait, why don't we know this and then do the work to make that work happen? And it's just such a large narrative. So now we now know the anatomy. So now once you know the anatomy, you can understand from a surgical standpoint, because I'm a surgeon, we were doing surgeries. You can do surgeries and you can injure the clitoris. And so that was essentially happening to a lot of people, is that if you don't know anatomical structures or even the full anatomy, you can't safely do surgery. And so practices like labiaplasty, which again are very, very common surgeries that happen oftentimes for cosmetics, they were injuring these structures. And so it's like you cannot operate safely on structures that you don't know. So laying down that foundations of medicine and science is just so groundbreaking. And it just means that there's so much more that we can learn. So she did so many things. And then also, I think, really highlighted of like, wait a second, we didn't know this. What else don't we know? So, I mean, she's just such a pioneer, and I have such deep respect for her and her work. And I just obsessed.
Yeah, it is such important work. And ever since her work came out, people have been making models of the clitoris and 3D printing replicas of them. And I've seen these out and about in lots of places. I have some around here in my office. And these models really help people to better understand, like, what does the clitoris actually look like and how is it situated in the body? And you see that it's actually a lot bigger than you might think or would have expected. Because when people think about the clitoris, they often just think about the small external portion that you can see, but so much of it is internal. And I think you make a really compelling case for why we need to understand clitoral anatomy, because if you have doctors who are performing surgeries in that area and you don't understand where the clitoris is located and, the way that it's situated in that part of the body, yeah, you can cause damage. And I have read lots of really unfortunate accounts of women who have reported loss of sensation or pain or other injuries as a result of surgeries where the doctors didn't quite know what they were doing because they didn't have that understanding of clitoral anatomy.
Yeah, yes. I mean, again, everything that I do is oftentimes spawned from a patient's encounter and experience. If patients, this is why I love talking to patients and I tell them your story matters because those stories, because like otherwise, we are just doing things to people thinking that we're doing the right thing. Like most physicians are always thinking that they're doing the right thing. It's the patients who are like, whoa, 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 no, you're not. So I always try to encourage anyone to give feedback, right? To let us know how we are either helping or harming. These stories matter because those stories then make us get curious about why is this continuing to happen? I guess because we just never knew anatomy. So let's go learn anatomy. Which again is wild. It's a wild statement to make, but that's just where we're at in women's health, unfortunately.
Yeah, and I mean, just think about how if clitoral anatomy was only mapped or detailed less than 20 years ago, that means any textbook that existed before that isn't going to have had that information in it. And so you've got a lot of doctors out there who just don't have that information unless they're otherwise keeping up with the literature. So it is really, really important to have this understanding. Now, on a previous episode of the podcast, we talked about how there's this popular claim that the clitoris contains 8,000 nerve endings. And this figure is repeated often in the popular media and in textbooks. But in digging into the source of this claim, it turns out that it actually came from a study of cows, not humans. And no one had ever actually tested to see how many nerve endings exist in the clitoris until you came along. So tell us a little bit about what you did in this study and what did you learn about how many nerve endings are actually in the clitoris?
Yeah, so I like to say that the study came from spite, honestly. So when I graduated from fellowship, because there's so little of us, I graduated as a world expert, not because I'm like, had done the things. It's just like, oh, you got some training. Great. We'll look to you for things. And so I love this work. I'm obsessed with it. I'm very passionate about it. And I felt so honored that I got asked to be a speaker at a pelvic pain summit. And there is, again, kind of this dismissive attitude around these conditions. And so I was just super excited to teach and help people because I like, once I know better, I want to do better and I want to share this information with everyone. And so I'm on stage and I'm like, this is our approach to diagnosing these conditions. This is what the literature says. Like, this is where my research focus is going to be. And granted, I just graduated yesterday. I don't even know if I had even had my first job yet. And this person really sat there and challenged me. And like I said, like, this is where all the gaps in research are. And this is like a really exciting thing. You can look at it as a really depressing thing, but you can also look at it as like, oh, this is moments to get really deeply curious and start like making actual change and progress. And this person sat there and was like, well, we can't do any of that because there's no research. And I was like, that's the whole point of research, is that you start with something and then you come up with something. I was like, there exists in women's health this constant narrative around we can't do anything because there's no research. So this is just going to be the status quo. And I was like, that's not how progress works. It's a constant conversation and it's just like a lot of infighting. And I'm like, guys, we're here. You guys need to raise the conversation. Like, let's elevate this conversation because what are we talking about? People are suffering and they're dying from these things. Like, let's start having new conversations instead of like, well, they don't really deserve a quality of life. And because we just feel that innately, it's too hard to do research. It's too hard to do those things, but we won't then contribute to the research. It's like, oh my God. And also understanding that women's health is markedly underfunded. I am a urologist. We have rich industry support and rich support. And so I trained with the idea that, oh, there's a clinical question. Let's go do a research study, and how easy and how fun. So I'm on the phone with my dear friend, Dr. Blair Peters, and I was just like venting. And I was like, I'm just so tired of the constant narrative of we can't do anything, we can't make progress because there's no research. I was like, you have to first create the research to then build upon it. Like, you have to start somewhere. And I'm just ranting. And I was like, and we don't even know how many nerves are in the human clitoris. And Blair goes, okay, well, you do know I collect those nerves for the surgeries that I do. So we can easily do that. And I was like, oh, say less. And it was a ragtag group of people, Dr. Paige Isabay, Dr. Blair Peters, and myself, a urologist, a gynecologist, and a plastic surgeon walk into a bar and create research. And so we did this research project. We got a very small grant, and I really just wanted to add to the literature of education and foundations. And we were just really excited to be able to work together because we're friends and then to potentially contribute to a body of work. But we didn't realize how much of a battle cry that project would become. And it blew up. It was in the New York Times. It was translated all over the world. And I think it speaks to the larger narrative of what the clitoris signifies and speaks to the larger narrative that the clitoris signifies female sexuality and sexuality and pleasure. And the cultural community was still getting it wrong, right? And it's like, oh, well, if they were getting it wrong, what else could we potentially get wrong? And, I'm just a big believer that the vulva deserves science. We deserve science. Women's bodies deserve science. And we have to change the narrative from, well, there's just not enough evidence to do science. It's like, you got to go create the science. So that's what this project meant to me of spite is a powerful motivator. Also, always collaborate and cross collaborate with people, because I could have done it as a urologist, but it was so much more powerful and robust study because we were able to do a cross collaborative project. I want to bring more science into this field.
I love that. And yeah, science is so important for understanding women's health, men's health, everyone's health. And, in the case of your research on the clitoris and nerve endings, I said there was that claim about 8,000 nerve endings that had previously existed in the popular media. So what did you find when you went and actually did the study?
Yeah, so we studied the dorsal nerve of the clitoris. We found over 10,000 nerves, but there's so much more. There's also more nerves that are smaller that the current nerve technology can't count. So this structure is so innervated, and it is so robust. And there's so much more research that we have to do and get to do. Like, we're literally just laying down the foundations of anatomy and physiology, which are the tenets of science and of medical education and training and of surgical training. And like, what could this potentially mean for people that have had clitoral injury? What could this mean for people that have decreased sensation? What could this mean for people that have increased sensation? There's just still so much that we have to do and we get to do. And how exciting and how fun is that?
Yeah. I mean, research is really exciting, especially when you have these new discoveries that are really advancing and changing our knowledge. Now, out of curiosity, do we know how many nerve endings exist in the penis? I wanted to ask this because there's also a claim in the popular media we often hear that the clitoris contains twice as many nerve endings as the penis. And that claim never quite made sense to me because the organs come from the same embryonic tissue. So I would imagine that they're probably going to be similar in terms of number of nerves, but would be different in terms of concentration and density. But what can you tell us about that?
All right, Justin, I love this question because there hasn't been someone working on it yet, but we are actually. So our research group is working on defining how many nerves are in the human penis. So the reason why it's a little different, and our numbers right now, we're collecting all that data right now, and they range. We see a significant range. And also the methodology or how we're doing it is slightly different just because of how the anatomy, like in the clitoris, you have a dual innervation. So you can take one of the nerves and you still have normal sensation versus in the penis, you have only one nerve. So you can't really sample that in a live patient. So this is all going to be done on cadavers, or it's being done on cadavers. It's a really, really, really exciting work. And also, it's not necessarily as significant potentially from a surgical standpoint. So, and this is because when we are trained on penile anatomy and how to do and operate on the penis, it's so meticulous. I love penile surgery because of how meticulous it is. And we are taught, okay, this is where the nerves run. All of our surgical principles actually factor that into our training. So we're truly learning about the nerves just because we want to advance science, but it actually, the way that our surgical principles are, it's really hard to injure the penile nerves if you are trained in a way that is acknowledging that they're there. Versus for clitoral surgery, they don't acknowledge that it's there.
Right.
And they're literally not taught on like the surgical principles of how to keep the clitoral nerve safe. And so our clitoral study really highlights even surgical deficits and safety practices that we don't see on the penis. And although I'm just from a curiosity standpoint, I love the work that we're doing around the penile nerves. It's not necessarily going to affect the safety. We already ingrained safety in how we are trained surgically on the penis. There's definitely not ingrained safety on the clitoris. And so this is why it's so fun for me to work on all genitalia, because I get to see how culture, science, policy, all of the things affect each genitalia very differently. So it's really unique how the type of genitalia determines what kind of level of care and attention to detail you get.
Yeah. Well, I love that you're studying all the genitals because there's so much more that we need to know. Now, in popular media articles about the female orgasm, there's a lot of talk about different types of orgasms. So, for example, people talk about clitoral versus vaginal orgasms. They talk about G-spot orgasms and blended orgasms. Some articles say there are as many as 10 or 12 different types of female orgasm. However, this is somewhat controversial. There are some who say that, yeah, there are all these different types of orgasms. And then there are others who say, nah, there really isn't a difference. You're just talking about different ways of stimulating the clitoris. So I wanted to ask for your take on this. Do you see there as being different types or kinds of female orgasm, or is it worth making distinctions between them?
Is it worth making distinctions? Yes and no. Are there different types of female orgasms? Yes. As someone that is a female and having orgasms, yes, there is. And also, they all feel great. Like that's, I think it speaks to a larger narrative of there's a difference between identifying and then ranking. And so this is the issue, is that so many people want to rank one over the other. And that's where, did you have an orgasm? Yes or no? Amazing. Were you aroused? Did you enjoy yourself? Awesome. So what's the problem? And like, that's the way that when we are categorizing things, is beautiful if we're like, oh, this is just, oh, that was a fun little one. That's a fun little thing. But we're like, so many people are like, I want the vaginal orgasm, or it's not a good orgasm. I'm like, who told you that? Our society is very phallocentric. So we have been gaslit to believe that a vaginal orgasm is better than a clitoral orgasm. In my culture, which is, if you look at non-Westernized approaches to sex and sexuality, there's no discourse like on which one's better or the other. Like they're like, pleasure is pleasure. And so that to me is why I say yes and no. Is it important to know? Because from a curiosity and identification and all the things and just like more information out there, yes, it's just so fun to learn these things. Does it matter from a pleasure standpoint? Absolutely not. And I want to free us all from the shackles of thinking one is better than the other. An orgasm is an orgasm is an orgasm. Thank whatever higher power or no power for the fact that we were able to orgasm. Because once we start hitting us and judging it and I think that's where it puts a lot of pressure on people.
Yeah, I love the way that you frame that. And, I see this all the time in the media where they seem to talk about certain orgasms as being better or more mind-blowing than others. And, every year, there's like a new orgasm trend that it's like they're trying to push people to experience. And I think the problem with, all these different spots that we've identified, like the G spot and the A spot and, all these different types of orgasms, is that people then feel like there's something wrong with them if they can't experience that. And that's where, this discussion of types and kinds of orgasms, I think becomes counterproductive because people are like, well, my body must be broken or damaged or hurt in some way because I can't experience this kind of pleasure that somebody else experienced. And the way they described it as being so amazing and mind-blowing, like, I really want to have that, but I can't have it. What's wrong with me? And so, that's where I think it starts to get problematic when we're talking about the types of orgasms. Like you said, an orgasm is an orgasm. Just focus on the pleasure and what works for you and enjoy that.
Yeah. And it's oftentimes It's the psychology too. It's sports. It's a lot of sports psychology. If you're like, I need to orgasm. I need to orgasm this way. And you're just hyper focused on it. It makes it so your body is tense. And orgasm happens in states of surrender, in states of relaxation. And if your mind is hyper focused on this goal, you're not in your body, you're not present. And so a lot of sexual health and a lot of sexual experiences, when you have a goal in mind instead of just enjoying the journey, actually makes it so much harder to get to that goal. If you just let go of pretenses and just kind of learn to relax into things, your body knows what to do. Pleasure is a birthright. It is deeply ingrained in you. You will get there. And so that's the other thing, is like freeing us from the shackles of the ranking of orgasms. Yeah, it's too much.
Yeah, definitely. Now, before the show, I was reading an article you were quoted in about things you don't know about the clitoris. And one of the things on that list that you spoke to was the important role of testosterone in clitoral health and function. So I was wondering if you could tell us just a little bit about that, because I think that might be surprising to a lot of people.
Yeah. Yes. So the clitoris is actually the sister or the brother of the penis. They're identical structures that we know of now. And again, this is the work that we do of, in 10 years, like I might be canceled for saying that. I don't know. But this is exactly the fun part about this research, is that it's so new. So that's the working theory now, is that the clitoris and the penis, the same structure. And so what we know about penile physiology and how the penis works is that it's a very testosterone mediated structure, meaning that testosterone is what keeps your penis and the penile tissue healthy. And so we found that in a lot of gender affirming work and people that are taking exogenous testosterone, their clitoris grows. And so we can then extrapolate that the clitoris is a very testosterone driven hormone. And so we'll actually see, and you'll see those changes. That's one of the changes I talked about in your garden. People that are perimenopausal, menopausal also have decreased levels of testosterone, and you can actually see your clitoris change. You can see the clitoris shrinking. This is another great reason as to why local hormones are really helpful, not from a disease state, but also from a pleasure state. Your clitoris, if you want that tissue, it's like clitoral dysfunction. It's like erectile dysfunction. It's much harder to get blood flow to the tissue, to feel a sensation to the tissue if your muscles of the clitoris are atrophying or shrinking because of the lack of testosterone. So if you want continued arousal and that feeling of feeling good, and it feels good to the touch, testosterone is really, really, really important for that.
Yeah. Thanks for sharing that. One final question for you. Is there anything else that you want people to know about the clitoris? As a physician and sexual health educator, what else should people know?
So 2 things I want people to know. For clinicians, I want them to start examining the clitoris. It is a part of the body. You have to start examining it. If you are doing a pelvic exam, please examine the clitoris. And then for non-physicians and physicians with clitorises, learn how to clean your clitoris. It's a very fascinating and unique thing. When a baby that's born with a penis and that's not circumcised, they go home, and before they go home or they're in the pediatrician's office, they're learning about foreskin management and how to keep the penis clean. The clitoris is an uncircumcised penis in a way, right? And yet a lot of people don't get that training and that education on clitoral health and how to keep their clitoris clean. And that takes pulling back on the foreskin, using gentle exfoliation with a wash rag or a Q-tip. Because if you don't do that, much like a penis that you don't clean, it can result in phimosis, which means that the skin gets stuck to the clitoris. It can result in pain, can result in infections. And this is happening to a lot of people because, again, the medical community is doing such a poor job about training you on how to keep your body healthy that you're going to have to be the one to learn these things. It's a very inflammatory thing of clean your clitoris, but it's so funny. I was giving this lecture when I was a clinical professor, and so many of my residents had just had baby girls, and they were all like, "Oh my God, no one told us." And I was like, "Yeah." So now you know, because it can actually lead to disease states, and so it's really, really, really important to clean your clitoris. Actually, just look at your vulva. Look at your vulva, everyone. You should be looking at your vulva every couple of months, because these changes that I talked about are probably happening as you speak. and you go to your doctor and they don't notice. So you're going to have to be the one to notice these things and then go seek help when they're happening. So clean your clitoris, check your vulva.
I think that's great advice. And yeah, it is so important for us to look at our genitals, to be familiar with what they look like in a normal, typical state. Because if you don't look at them often, it can make it all too easy to think that there's something wrong when actually, hey, maybe that was there all along and maybe there isn't a problem, right? But it can also help to alert you to problems when they might arise as well. So thank you so much for sharing all of this amazing information with us, Maria. It was a pleasure to have you here. Can you please tell my listeners where they can go to learn more about you and your work?
So you can go to marialocomd.com to stay up to date on all the things that we are doing, podcasts, articles, book with me. I have a clinic in Beverly Hills in LA, if you're in LA, and I have educational consultations for anyone outside of California that wants to figure out how to get diagnosed, how to get treated, because a lot of the conditions that we're calling chronic, again, are not chronic. Your doctor just doesn't know. You can also follow me on Instagram, Maria Uloco MD. Love to drop educational, fun little nuggets. I'm also on TikTok as SexMedEd. I'm really bad at TikTok. Keep forgetting that I have it. I'm also on Twitter at Maria Uloco. And also follow and subscribe and join the waiting list for Vulva AI. The more followers and subscribers that we have makes it so that this dream becomes a reality.
Well, thank you for the work that you do, and I will be sure to include links to all of that in the show notes. Thank you again so much for your time. It was a pleasure to have you here.
Thank you so much.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. You can also follow me on the socials for daily sex research updates. I'm on Twitter and TikTok at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. And if you have a question you'd like me to answer on a future episode of this show, you can leave me a podcast voicemail at speakpipe.com/sex and psychology. Thanks again for listening. Until next time.